showing the hierarchy of the US clinical experience, which is an integral part of your CV. So like many of you know, let me confirm the fact that this portion of your CV is extremely important when you apply for residency. Basically, you would need 4 LORs for most programs, and one LOR should definitely be from your country of residence and from your medical school. The one letter is also from the dean, which is the medical school performance evaluation, and the other one could be from the head of department or chair of medicine, for instance, if you're applying for medicine. The other 3 LORs have to be American LORs. So how do you get them? You have to have a thing called as the USCE, US Clinical Experience, which has a couple of things that people are a little confused about. One is observerships, which is where you don't get to do the hands-on work. You can just shadow somebody, but you cannot actually have access to the patient data and records. That is observership, where you're just observing truly so. The second one is electives. Electives is actual hands-on experience. You pay to be a medical student, and you are actually a medical student at that place for the month that you have gone for. And you have access, you get to interact with patients. It's a wonderful experience, trust me, and you get to learn procedures as well. You don't necessarily get to perform them, but you do have a very intimate interaction with the attending and with the patients. The third category is somewhere which I do not have a lot of information about, but I can say that if you ever get an opportunity to work on sub-internships, which are also called sub-Is, they are an excellent way of getting to know people here and speaking to people in the program that you're interested in. So if you get a sub-I in one of the programs, then that is the thing that you should never leave. You would probably need to have contacts to get a sub-I. I don't know how that would work for any other student. If your medical school has contacts with medical school you're interested in, then you should ask. The first thing is for a sub-I. Then there are a thing called as externships. So sub-Is, externships and electives are hands-on experiences. They are the ones that are most accountable for when you are applying for residency. Observerships are great as well. Voluntary research activities are also very good. They also may not allow you to interact with patients, but they are very good people to know that you are a hard worker. So all these things help you get an LOR, which you need to put in your CV. And I would say that at the end of these electives, that is the time when you should take your CS exam, because you have had sufficient information